going to be doing my sterile dressing change. I'm gonna show you what all I have here. I have my wound from the body parts kit, so I'm just gonna put it right there. That way so you can see it whenever I dress it. I have my kit, and I have this dressing pad. Normally these would be in here and they would be sterile, but there is not one in here for some reason. So I found this in my lab kit, and we'll pretend that it's in here whenever I open it and it's sterile. If this were in the real world and it wasn't in here, I would get this out of the clean holding, you know, and lay it down in a sterile technique. So we will pretend this is in here when I open it. I have my sterile gloves. There are some in here, but this one fits me a little better. I'm not sure if this is the size that's in here. I know that a lot of these kits do not have my size, and sometimes they're even a little too big, but we will see. We'll go with it. And I have clean gloves. Okay, so before we start this procedure, I would go in and I would talk to my patient about what I need to do. I would assess them for pain, if it's getting close enough time for them to have pain medicine, and if the wound is very painful, very uncomfortable during changes, I would ask if they would like some pain medication. If they do, I would give it to them. I'd wait about 30-45 minutes before I would start this procedure. So once the patient has been medicated and it's been the long enough amount of time, I will gather my supplies and I would take it into the patient's room. I would explain what I'm getting ready to do, get their permission, and I would ask them their 2 patient identifiers. Once I know that I have the right patient, I would perform hand hygiene and I would don clean gloves. I would raise the bed of the patient up to a comfortable level. Once I have the patient up to a comfortable level and I'm not having to bend over, I'm going to remove the old dressing from the outside in around the edges, and then I'm going to hold that old dressing in my hand, and I'm going to start taking the gauze out from the center out. If the gauze is sticking, I would take normal saline and squirt some on there a little bit just to help. That way you're not ripping out the, you know, the wound, not ripping it out and causing a lot of bleeding and more pain than you need to. So I would take it out, I would look, and I would note the type of drainage that may be on there, the amount of it, and I would note the color and odor, if there is an odor. And then I would have placed it into my hand, into the old dressing, and then I would dispose of it in the garbage. Then, after I have all that done, it is time to set up my sterile field. I'm going to remove my old gloves, throw them away, perform hand hygiene, probably hand sanitizer. We're going to open this, and this is going to come out. What we do is we you're not actually supposed to shake it like this. It's supposed to just open. We're going to give it a little help. Normally we wouldn't do that. It's over. I'm going to make sure that it does not touch anything whenever you're shaky, kind of helping it open. Then it'd break sterile field. This here, remember we already opened this, but I'm going to make it like this. Normally I'd have a bedside table, but at home I don't have that luxury. And here we have more sterile gloves, we have tape, we have a mask, because we would want to mask up for this. We are not supposed to just reach in because that would break sterile film. So what I like to do, as long as I hold the outer edges, I like to take, and you do not reach over this. Just kind of let things fall and hope things go where you want them to. So that's there. I'm not going to touch that right now. Right now I want to put on my sterile gloves. So I'm going to open these. Pretend that these never been opened before. And do like this. Your arm with the other sterile glove. Take this, go, throw it in the floor. Okay, so now I can touch anything that laid in here. We're going to take this little dressing. I'm gonna put it right here. Take this. Only I put this on. We're just going to throw that away. I don't need that. All right, so alcohol stick, wrinkles. And never reach below your waist. We're going to grab these. I am not sure why this is in this kit because I'm not going to take an alcohol swab to a patient's open wound. So we're going to throw that away. Did not throw it at the patient. Let's throw it down on the ground. Not sure about this. Okay. All right. So normally there would be a little, I would have a cleaning solution that is good for the wounds, and I would take the label to the palm, open it up, and pour. Don't reach over, but pour it in here. Set that down, and then I would take these gauze, and I would wad them up, and I would soak them into the solution. So while those are soaking, I'm going to clean my wound. I'm going to take these cleaning swabs. They usually have iodine in them, and place it into my dominant hand to clean. So with each swipe, you need to clean from the middle out with a different swab each time until it's all clean. So swipe, clean, swipe, clean, swipe, clean, swipe, clean. And then I would throw each one away. The reason why you would do that is so you don't get any germs from the outside, any bacteria inside the wound, because we were trying to heal the wound from the inside out, not make it worse. So I did that. Now I'm going to take my little Q-tip and place it in my dominant hand without touching the yuck. I'm going to come over here and get to my soaked gauze, wring it out a little bit. Sometimes you can wring them out, other times if it's a wet to dry, just leave it like that. I'm going to come over here, and keep in mind I would normally have a bedside table, but I don't have one here at home, so I'm trying to not contaminate my sterile field. You never want to reach over. I'm going to then place my gauze onto my cotton swab and put it and pack my wound. One thing I failed to mention before we do anything like that, and after we remove the old dressing, we want to measure it. You want to measure the length, the width, and the depth. And if there's any undermining, you would take a little Q-tip and kind of measure around, and you would take your little ruler that would come in it and just kind of, measure it with the tip of the applicator here. But we did all of that. So I'm going to come over here and get another one, and I'm going to place it without getting my non-dominant hand contaminated onto the Q-tip and pack it. Now I would continue doing that until it's completely full and throw that away. I would then take an ABD pad or a small pad that is similar to that and put it on top of this dressing. We'll pretend that this is that ABD pad. Now I'm going to go over here, put that on there. We will then tape. It's covered, so we don't really have to worry about sterility anymore. Take the tape, put it onto the patient. I don't need to worry about this anymore. I'm done. And I'm going to want, well, it's on there, but I would then take and label with my initials, time, and the date, so when the next nurse comes in to do a dressing change, they know who did it last and when it was done last. You want to do it as needed or every shift at least, unless the doctor's order states, to do it every so many days or whatnot, depending on how bad it looks. There are usually wound care orders in for these things. And then I would take and clean up my mess, take off my sterile gloves, throw them away, perform hand hygiene. I would then ask the patient if they are okay, how they tolerated it. If they're okay, I'm going to lower the bed back down to a safe height and give the patient their call light and anything else they might need. And I would then go document everything that I came into as far as what the drainage looked like when I took it off, the color, the odor of it, the type of drainage, and the amount of drainage. And then I would document how the patient tolerated, if they did very well or didn't, if I needed to stop what I was doing because the patient wasn't tolerating it very well, and wait a little while, and then document what supplies that I used and under the right time. And that would be it. So something I forgot to mention whenever I was packing the wound, once you finish doing that, you need to remove your dirty sterile gloves, perform hand hygiene again, kind of air dry your hands because it's too hard to put gloves back on after that, and then put on a new pair of sterile gloves. The reason why you do this is you don't want to get what's on your hands, on your old sterile gloves, on the clean dressing top. Is what they'll be putting back on after that. But you do not want to get that grossness on top of the new dressing.